Over the last 24 hours, we have identified 296 new cases of COVID-19 and completed about 6,800 tests. Our positivity rate was about 4.6%. We have identified 305 additional cases of variants of concern in the last 24 hours. That is cases that extend further back historically, which is why that's larger than the total number of COVID cases. There are currently active alerts or outbreaks in 364 schools, which represents 15% of all schools in the province. Again, this represents a number of outbreaks declared within the last 28 days, which includes some outbreaks prior to the 2-week closure. Hospitalizations continue to decline, and there are now 411 people being treated for COVID-19 in hospital, including 120 in the ICU. Sadly, 5 new deaths were reported to Alberta Health in the last 24 hours. We must never forget that these are not just numbers. They are people who lost their lives to COVID-19 and who leave behind family and friends who are grieving them. My thoughts are with everyone who is mourning a loss, whether from COVID-19 or any other cause. I want to talk briefly today about a change that was made yesterday around contact tracing for variants of concern. With the lab now screening all positive COVID-19 cases for these variants, case investigation teams will now be restarting second calls for cases with variants of concern other than the B.1.1.7 or UK variant. The second notification will allow AHS to do even more in-depth investigations to find out where the case may have been exposed. While it remains critical to minimize transmission of all COVID-19 cases, we want to pay particular attention to the lower volume variants of concern, specifically P1, sometimes known as Brazilian variant, B.1.351, sometimes known as the South African variant, and B.1.617, sometimes known as the Indian variant. In these cases, we have opportunities for more aggressive containment. As the B.1.1.7 variant is our dominant strain, we will not be doing second calls for these cases. And these second calls are in addition to all the other case investigation and contact tracing work that happens for every single positive case. We have now administered more than 2.88 million doses of COVID-19 vaccine in our province. This includes more than 44,000 doses yesterday. I'm pleased to see that there has been strong interest in booking second dose appointments among those who got their first dose in March or earlier. For months now, I and other medical experts have stressed the importance of getting vaccine. This is because vaccines work. They save lives, and they are our path out of this pandemic. Since January 1st, 96% of all confirmed COVID-19 cases in Alberta were either unvaccinated or diagnosed within 2 weeks of receiving their first dose while their immunity was still building. Just 0.2% of all people who had one dose of vaccine in that time frame since January 1st got COVID once 14 days had passed since that shot. This shows you the power of the vaccine at preventing infection. When we look at hospitalizations and fatalities, the same story emerges. Since January 1st, 93% of the COVID-19 cases that ended up needing hospital care were either not vaccinated at all or diagnosed with infection within 2 weeks of receiving their first dose. In that time frame since January 1st, up till yesterday, there were 706 deaths due to COVID-19. 88% of these deaths were in individuals who were unvaccinated or who were diagnosed with infection before the vaccine had a chance to be effective within those 2 weeks from their first dose. These numbers reinforce just how important vaccines are. While no vaccine or treatment for any condition is ever perfect, these vaccines work better than we could have expected. we can expect both the number of hospitalizations and deaths due to COVID-19 to decrease even more, as more of the population is protected by first and second doses.